Mr. Speaker, coronavirus continues to spread throughout the world. The latest figures show that 17,337 people have sadly died here. Our hearts and the hearts of the whole House go out to their loved ones. I know that across the House we are united in our determination to fight this virus with everything we've got. And today, Mr. Speaker, I wanted to update the House on each part of our battle plan. First, the resilience of the NHS. I can tell the House that for the first time, we now have over 3,000 spare critical care beds in the NHS. That is more than 3 times more than we had at the start of this crisis. It's thanks to the incredible work of an awful lot of people that we now have this extra spare capacity, even before we include the new Nightingale hospitals. Over the past 2 weeks, I've been lucky enough to attend, either in person or virtually, the opening of 4 of these new Nightingales in London and Manchester, Birmingham and Harrogate, and there are several more to come all across the UK, in Belfast, in Glasgow and Cardiff, Exeter and Sunderland. These incredible efforts from dedicated staff, supported by our armed forces, mean that our NHS has not at any point been overwhelmed by coronavirus. Some said this would be impossible. And today, I want to reinforce the message that non-COVID NHS services are open for patients. The NHS is there for you if you need advice and treatment. And I want to address very clearly this message to those who might be vulnerable to heart attacks or stroke, to parents of young children, to pregnant women, and to people with concerns that they may have cancer. I want to emphasise that people with non-coronavirus symptoms must still contact their GP. If you think you need medical help, please contact your GP either online or by phone to be assessed. If you need urgent medical advice, use NHS 111 online, or if you can't get online, call 111. And of course, if it's serious or life-threatening, call 999. If you are told to go to hospital, the place you need to be is in hospital. The NHS is there for you and can provide the very best care if you need it. The second point of our battle plan is on supply and working to boost supplies of core equipment. Now, the full weight of the government is behind this effort, and again, we've brought in the armed forces to help us meet this demand. This includes ventilators, both purchasing extra stock and increasing the production of new ones. We now have record numbers of ventilators, with 10,700 available for use for patients. It includes medicines, so we can make sure everyone has access to the supplies and treatments they need. And of course, it includes personal protective equipment too. In normal times, the NHS PPE supply chain supplies 233 hospital trusts. Currently, 58,000 separate health and social care settings are being supplied with PPE. So we're creating that whole new logistics network from scratch, and we have some of the best minds in the country working on this. I'm grateful to colleagues from the NHS, Public Health England, the Crown Commercial Service, Cabinet Office, Communities Department, MOD, the Armed Forces again, devolved administrations, territorial offices, the Business Department, the Treasury, the Foreign Office and the Department for International Trade, because they are all playing their part. And last week I appointed Lord Dighton, who delivered the Olympics, to a new role in driving forward PPE manufacturing here. Since the start of this crisis, we have delivered over 1 billion items of PPE, and we're constantly working to improve the delivery system and buying PPE from around the world. We're also working to make more at home, and I'd like to thank the UK businesses who've generously come forward with offers to turn their production lines to part of this national effort. And I'd also like to thank members from across the House who put us in contact with businesses in their constituencies. We're actively engaged with over 1,000 companies who buy from abroad and working with 159 potential UK manufacturers. We have a rigorous system of verifying the offers that we receive, because not all offers have been credible, and it's important to focus on the biggest, most credible offers first. This work is crucial so we can get our NHS and care staff the kit they need so they can do their jobs safely and with confidence. The third part, Mr. Speaker, is to scale up testing. I've set the goal of 100,000 tests a day by the end of this month, and I'm delighted to say that the expansion of capacity is ahead of plans, even though demand has thus far been lower than expected. We are therefore ramping up the availability of this testing and expanding who is eligible for testing to making it easier to access the tests. The tests are conducted in NHS hospitals, through our drive-through centres, mobile units and home deliveries. These tests are then sent to laboratories. We've completed the construction of 3 lighthouse labs in Milton Keynes, Glasgow and Cheshire. Each site took just 3 weeks to complete and begin testing. And as we have reached the peak, and as we bring the number of new cases down, so we will introduce contact tracing at large scale. The introduction of the new NHS app for contact tracing is also in development. And as we do this, we're working closely with some of the best digital and technological brains, renowned experts in clinical safety and digital ethics, so we can get all of this right. The more people who sign up for this new app when it goes live, the better informed our response will be, and the better we can therefore protect the NHS. Fourth, Mr. Speaker, we need to make sure we make the best possible use of science and research to pursue the vaccines and the treatments that are essential to defeat the virus once and for all. And here the UK is at the forefront of the global effort. We've put more money into the global efforts to search for a vaccine than any other country. And yesterday I announced over £40 million of funding for the 2 most promising UK projects at Imperial and Oxford. And the vaccine for this Oxford project will be trialled in people from tomorrow. And I'm sure that the whole House will agree this is a very promising development. And I'll repeat what I said yesterday, which is that in normal times, reaching this stage would take years. And the combination of this innovative group of people at the Jenner Institute in Oxford and the MHRA, the regulator, who deserve our special praise because they are both ensuring that the process is safe, yet is also conducted more rapidly, probably than ever before. And they deserve the support of the whole House in that work. At the same time, we'll invest in manufacturing capability, because if either of these vaccines work, then we must be able to make them available for the British people as soon as humanly possible. The fifth measure I will talk about, Mr. Speaker, in the time available, is the one where everyone can play their part: social distancing. And I just want to thank everyone from across the country for their steadfast commitment in following the rules, including in this House. It is making a difference. We are at the peak. But before we relax any social distancing rules or make changes to them, we have set out the 5 tests that have to be met. First, that the NHS can continue to cope. Second, that the operational challenges have been met. Third, that the daily death rate falls sustainably and consistently. Fourth, that the rate of infection is decreasing. And most importantly, fifth, that there is no risk of a second peak. Finally, Mr. Speaker, we're working to protect the most vulnerable through shielding. This is the 6th part of our battle plan. There has been a huge effort underway across government to contact and support those at risk. We've been boosted by the support and the help of the heroic NHS volunteer responders who signed up in their droves. Within 2 days of our call to action, an unbelievable 750,000 people put themselves forward for this initiative. So with the volunteers and with the support of the Communities Department and the NHS and local councils who've done amazing work on this, that we are shielding the most vulnerable. Mr. Speaker, these are unprecedented times for us all, and we've all seen the extraordinary impact of coronavirus in our constituencies and across the country. And even though today we are physically separated, this House is at its best when we are united in our purpose and our resolve. So I will keep working with members right across the House in this fight against this invisible killer, because this may be akin to a war, Mr. Speaker, but it's one where the whole of humanity is on the same side, and I commend this statement to the House.